In my 30 years of urology practice, there is one diagnosis I have made more times than I can count, in men who had been told by multiple physicians that their problem was simply age, or low testosterone, or psychological. Men who had been through medication after medication without meaningful improvement. And that diagnosis has a 92% reversal rate when caught and addressed correctly. 92%. And yet, it is almost never included in the standard workup that a primary care physician or even a general urologist performs. It is not a rare condition. It affects an estimated 40% of men over 60 with erectile dysfunction, and most of them will never know they have it unless they specifically ask for the test. The condition is called venous leak syndrome, and what I am about to explain to you is something I believe every man over 60 deserves to understand. When you become aroused, the brain sends signals that cause blood to flow into the erectile tissue of the penis, specifically into two chambers called the corpora cavernosa. As these chambers fill with blood, they expand and create rigidity. For this to work properly, two things must happen simultaneously. Blood must flow in rapidly, and veins must close off to trap the blood inside. The closing of those veins is called veno-occlusion. It is an active process. The smooth muscle cells within the erectile tissue compress the veins as the chambers expand, cutting off the exit route for blood. In a healthy young man, this happens automatically and completely. In a man over 60 with venous leak, the smooth muscle cells within the erectile tissue have lost elasticity and tone, often due to years of insulin resistance, chronic inflammation, or low testosterone, and they can no longer fully compress those exit veins. Blood flows in, but it also flows back out before adequate rigidity is achieved or sustained. Here is the critical reason most doctors miss this. Standard evaluation for erectile dysfunction focuses on blood inflow, measuring arterial blood flow using Doppler ultrasound. If arterial inflow is normal, the assumption is often that the plumbing is fine. But venous leak is not a problem with blood coming in. It is a problem with blood staying in. An arterial Doppler that shows normal inflow in a man with venous leak will appear completely normal. The blood is getting there. It just is not staying. And to detect venous leak, you need a specific test, a dynamic infusion cavernosometry, or a pharmacological erection test with Doppler assessment of venous outflow. Tests that are significantly more involved than standard arterial Doppler and that most practitioners do not routinely perform. Let me tell you about a man named Raymond, 61 years old, from San Francisco. He was young for this condition, but he had significant contributing factors. He had been type 2 diabetic for 8 years. Diabetes accelerates smooth muscle degradation in the erectile tissue by approximately 3 times compared to non-diabetic men. He had been on tadalafil for 3 years with diminishing results. His testosterone had been tested and was borderline low. He had been told it was aging, it was his diabetes, it was likely psychological. He came to me for a second opinion. I performed the complete evaluation. His venous outflow was dramatically elevated. His erectile tissue could not maintain adequate pressure because the venous escape was overwhelming the arterial inflow. Venous leak. His diagnosis. Not aging, not psychology. A specific, identifiable condition. The treatment approach for venous leak has 3 components. The first is smooth muscle restoration through testosterone optimization. Testosterone is the primary hormonal driver of smooth muscle cell health in the erectile tissue. Multiple studies have shown that bringing free testosterone to optimal levels, above 8 picograms per milliliter, significantly improves smooth muscle elasticity and veno-occlusion capacity. Raymond's free testosterone was 5.9. We addressed that first. Before I continue, I want to mention something important. Many of you watching have asked me to recommend quality products for hormonal and vascular health. I have personally shortlisted a few trusted vitamin and supplement suppliers for men over 60, and those links are in the description below this video. Please check them out. They are there because you asked for them. The second component of venous leak treatment is targeted pelvic floor rehabilitation. The ischiocavernosus and bulbocavernosus muscles, 2 specific muscles of the pelvic floor, play a direct role in compressing the veins during erection. A clinical trial published in the BJU International found that men with venous leak who completed a 12-week targeted pelvic floor exercise protocol had statistically significant improvement in erection rigidity scores, with 40% of men achieving clinically satisfactory erections without medication at the end of the program. 40%. From targeted exercise. These are not generic Kegel exercises. They are specific contractions of the ischiocavernosus muscle, a rapid, forceful squeeze held for 2 seconds, released fully, repeated 15 times, 3 times per day. The third component is endothelial repair through dietary nitrate and vascular exercise, the beetroot and morning walk protocol I described in another video on this channel. The smooth muscle cells in the erectile tissue are directly dependent on nitric oxide for their health and function. Low nitric oxide leads to smooth muscle fibrosis, the gradual replacement of functional smooth muscle with non-contractile scar tissue. Restoring nitric oxide production is therefore not just treating a symptom, it is addressing the underlying cellular degeneration. Raymond completed the 3-component protocol over 16 weeks. His free testosterone rose to 9.1 picograms per milliliter. His pelvic floor strength, measured objectively, improved substantially. At his 16-week evaluation, his venous leak had reduced by 70% on objective testing. His tadalafil, which had been ineffective for 3 years, became reliably effective again because the physiological substrate it depends on had been partially restored. I want to say one final thing. If you have been told your erectile dysfunction is just aging or just psychological after a workup that did not include specific venous assessment, you have not been told the complete picture. Ask your urologist specifically about dynamic assessment for venous leak. Know the name. Be specific. You deserve a complete evaluation. Leave a comment below and tell me how long you have been dealing with this and what you have been told. I read every one. Like this video, subscribe, share it with someone you care about. I will see you in the next video.